Let's talk about pain. So, I want to tell you when pain is a priority and when pain is not a priority. Now, for your pain scale, you have 1 to 10. Right. So, 1 to 6 is not a priority, 7 to 10 is a priority. Right. Now, for trauma and injury, example fracture. Right. Trauma and injury definitely should cause pain. So that kind of pain is expected. So this pain is not a priority. Now, for um procedures such as medical procedure and surgical procedure, right? It can either be expected or unexpected. So it depends on the kind of medical procedure and it depends on the kind of what surgical procedure. So if a patient had a medical procedure, you need to ask yourself, is that pain expected or not expected? Now for surgical procedure, the same thing as well too. If a patient return from surgery, you need to ask yourself, is that pain expected or unexpected? It depends on the kind of situation that is occurring. So it's about the situation. Now, on a normal day, right? A patient return from surgery is expected for them to have pain, but there are some certain kind of pain that is not related to that kind of expected pain we are talking about, such as what? Incision pain. The expected pain we are talking about is what? Incision pain. So any other pain like patients have abdominal pain after surgery or pain related to infection, they are unexpected. Right, they are unexpected, but incision pain is expected. Now we also have pain related to location, right? We have head, right? Now let me tell you something. Headache, right? A patient can have what? Headache, right? This is a neurological symptom. Now, one thing I want you to know is this: hypertension can cause a patient to have what? Headache. Hypertension can cause a patient to have what? Headache. Now, any other condition can cause a patient to also have headache. So this is going to be like any other condition, right? Can cause a patient to have headache. Now, so if you have a patient who have hypertension, who have headache, or a patient is having any other condition and they're having headache, the any other condition is more of a priority to you than hypertension, right? So I want you to take note of that, right? A patient with hypertension, they experience headache, but uh most patients will not experience headache. Right. So because some patient might not. So it depends on what? The blood pressure reading. Right. That will might prioritize patients with what? Headache. Right. But for any other condition that is causing headache, we want to prioritize that headache immediately. Right. So take note of that. Now, chest pain. I have it right here. Now, chest pain. Now, if the NCLEX just tell you a patient is having chest pain, right? You want to prioritize it. Now, the NCLEX is telling you the patient have chest pain. They gave you no condition. They did not tell you the condition of the patient. That is a priority. But now, if the NCLEX is telling you the condition such as this now, right? God, it's expected, right? Might not be expected, might be expected based on how you want to think about it. But we know why this patient is having chest pain, right? So we can say, okay, it's expected, right? Now, let me just put it, it's expected, right? Now, another reason why a patient might have chest pain is after what? Heart surgery, right? After heart surgery, right? So some people say open heart surgery, right? Now, they have that chest pain most times when they what? Cough. So they have that particular pain. So this kind of pain is not um consigning, right? It is not concerning, it is unexpected pain. So it's not a trouble at all, right? Now, a patient that is having pain after insertion of what? NG tube. That this kind of pain is a priority, right? A patient that is having pain to their site, I already talked about it, to a particular site, surgical site, is not a priority. Now, we also have condition related pain, like a patient that is having inflamed pancreas, that pain is expected. Inflamed gastric, right? That pain is expected, right? Right? Pancreatitis, gastritis, those pain are expected, right? Appendicitis, those pain are what? Expected, right? So yes, we've covered everything I have, right? Okay, I have one here, which is abdominal pain from the abdomen, right? So pain from the abdomen can be expected depending on the condition, right? If a patient return from surgery, right, and they are having pain, we expect incision pain. If the surgery is done related to the abdomen, we are expecting what? Incision pain, not abdominal pain. Abdominal pain is a different thing entirely, because we did surgery and then the patient should be having incision pain. We perform the doctor perform a certain surgery to the abdomen. The patient will have incision pain, not abdominal pain. Right. When it's abdominal pain, further assessment need to be done, because they should not be having what? Abdominal pain. So if a patient return from a particular abdominal procedure and they are complaining of abdominal pain, that is a priority. Right. That is a priority on the NCLEX exam. So yeah, I've covered everything about pain. So next video I'm going to talk about when to prioritize infection.